Lung cancer symptoms you may not know about. Lung cancer is one of the most prevalent types of cancer there is. It is the most common cancer type in the world for men and the third most common for women. It also accounts for the most cancer-related deaths in the planet. In this video, we wanted to look at the symptoms and other important points. Make sure to stay tuned until the end of the video. The principal cause of lung cancer is smoking. 85% of cases are attributed to it, and it's not only active smoking that takes up the numbers. Passive smoking, a process whereby one inhales the smoke from another person who is smoking the cigarette, is also another potential cause. The most lung cancer-prone group is the 50 years or older group that has a history of smoking. The second main cause for lung cancer is genetics, causing about 8% of all cases. The relatives of people diagnosed with lung cancer are faced with twice the risk of a person who doesn't have any relatives with a history of lung cancer. Other causes include air pollution, radon gas, and other dangerous substances. Although lung cancer is prevalent throughout the world and has taken many lives, it can be cured with the proper medication and, better yet, preventive measures. The best preventive measure is to quit smoking, or, if one has never smoked, to continue that way. There's a tactic that has been employed by governments that has really been successful in keeping the people healthy, like what a country in Asia named Bhutan did with the complete ban of smoking implemented more than a decade ago. And because that's not realistic for some economies that rely on selling tobacco, they try to compensate by not allowing advertisements of tobacco products in mass media. Another very important preventative method is screening. This method is effective for people in the endangered age group of people older than 50 years. It helps to know if there is lung cancer because it is easier to cure it before it spreads throughout the body rather than in the later stages. This will also enable doctors and surgeons to carry out a surgery. If it's too late and the cancer has spread throughout the body, surgery won't be a viable option. Rather, chemotherapy and radiotherapy will come into play. So screening and checking if you have the symptoms are indispensable. In any case, it should be understood that the treatment depends highly on how soon we go to the doctor. The symptoms encountered differ on the stage of the disease one is currently in. There are 4 stages, and usually the more blatant symptoms show themselves in stage 3 and 4 because the tumor starts to grow and spread throughout. Although symptoms vary across different people, these are the ones that are prevalent and ones we thought you should know. Change in voice. Hoarseness in your voice does not necessarily mean that you have lung cancer, but it is important to be on the lookout, especially if this symptom is accompanied by others that we are going to mention. This symptom happens because the tumor presses down the vocal cord. Other changes in voices also occur, like scratchiness or huskiness, fatigue and tiredness. Just like the symptom we previously talked about, the sole existence of this symptom might not mean that one has lung cancer, but it'll cost nothing to be alert. When lung cancer occurs, the body is constantly trying to fight the disease, creating the feeling of lethargy and tiredness. If you encounter unusual tiredness, pay a visit to the doctor. It may not be lung cancer after all, but you'll definitely learn the reason of this tired feeling. Coughing. This could be a symptom for just about tens of different diseases and infections. When it comes to lung cancer though, most of the time, it's persistent. Cough has been shown to be a symptom that develops in the earlier stages, with 57% of people diagnosed with lung cancer in the earlier stages showing this symptom. At the advanced stage, however, it is much more common with 90% reporting serious coughing. There are many reasons as to why one could possibly cough. But if it is persistent, going to the doctor is highly advised. Dyspnea. Having difficulty to breathe is a major symptom of lung cancer. It actually comes with, among other reasons, tumors that grow in and around the lung, making it difficult for the body to get oxygen. Shortness of breathing might also appear as a side effect to cancer treatments like chemotherapy. If the trouble with breathing persists, one must immediately go to the hospital or, in extreme cases, dial the emergency number of their area. Chest and shoulder pain. Perhaps a lesser known and less obvious symptoms of lung cancer. This happens when a tumor called the pancreas grows and spreads from the lungs and touches the nerves surrounding it. This results in the pain of not only shoulders and chest, but also in the arms and the head. The above groups of symptoms are called the Horner syndrome. Of course, this symptom is also another one that can't always be attributed to the existence of lung cancer in one's system. If you've been playing football, fell down, and the next day felt some pain, it's probably not lung cancer. These were the main symptoms we thought you would want to know. Other symptoms that are less common but are worth mentioning include unexplained weight loss, difficulty swallowing, loss of appetite, wheezing, swelling of face. Thank you for watching. Tell us your thoughts on this video in the comment section. And if you learned something and enjoyed watching the video, give it a like and consider subscribing. We'll see you in the next video.